La medicina digitale ha un impatto importante sul modo di lavorare delle aziende farmaceutiche, ma per quelle di dispositivi medici non è sicuramente da meno. Noi ne abbiamo parlato con Klaus Pannes, a capo di B.Braun, una grande azienda produttrice di dispositivi medici che abbiamo incontrato a Milano in un evento organizzato da Advice Pharma presso il Politecnico di Milano. Klaus, which is the impact of digital medicine upon the device companies like B.Braun?
It definitely has a big impact, but we're not starting from scratch. We've been working with devices that are digital since a long period of time. For example, our infusion pump. But now, of course, we have new opportunities and new possibilities. Connecting these devices, generating data with these devices, work with these data. And this is a complete new area which is very, very interesting to expand also our area of work and to really work in processes and not just in providing a product.
Theoretically, every device could be improved with a connection, with some digital connection to physician or to patients, theoretically.
Theoretically, yes. I mean, there's since a long time the buzzword of Internet of Things, and more or less there will be more and more sensors connections that make this possible, and therefore the interoperability of the devices with the systems that work with the data, that analyze the data, also then with our customers in the hospital system is extremely important.
Okay, now from theory to practice, if you could provide us a couple of examples of projects, of products that you are selling and which has been improved with the digital connection.
Absolutely. I start with the infusion pump, which I mentioned already. Now we have a very innovative product on the market, which is called Space Plus, a very digital product that is not only digital itself, but we offer it together with a software called Online Suite Plus.
It's a pump?
The Space Plus is a pump, and the Online Suite Plus is the software to manage the data. So in an ICU, you can manage all the infusion therapies that are going on from a central point of view. And of course, you get all the alarms and so on. So it's also in the security aspect. But it also enables an automatic documentation of the therapy, and it connects to the hospital information system. Plus, there are also new possibilities which we call fleet management. That means if you want to upgrade your software, you can do it centrally for all the pumps in the whole hospital, which was a lot of work in the former times. And these are just some examples what we can do. All this is accompanied by a cloud solution that we call the B.Braun Health Cloud. And this is a solution where we put a lot of emphasis on cybersecurity. So we have an end-to-end encryption that gives you 100% security of the data because, of course, we have a high responsibility for this relevant data.
It's very interesting. Another example.
Another example, something completely different. We offer now, and it's also used already in the first hospital in Italy, an app called Dreams. And Dream is related to the ERAS protocol, so the enhanced recovery after surgery. This app connects the patient and healthcare professionals and covers the full perioperative pathway. So before the surgery and after the surgery, the patient is in direct connection with healthcare professionals, gets a lot of information about how to behave the right way, the mobilization, the nutrition, and so on, and has an added security because if really something happened that needs to be seen in the hospital, you can immediately react. On the other hand, if something happened, you're not sure, you can immediately clarify. And of course, this is how you can save costs and unnecessary hospital visits.
And for the future, which are the possibilities of this type of technologies?
I have to say the possibilities are endless. So if you just imagine having available the whole knowledge that we have in the world, the medical knowledge at every place of the world for your prevention, for your diagnosis, and for your therapy. This is something we're very far away from. And so we have a lot of solutions and ideas how to step-by-step reach this, but it's going to be a very interesting journey. Of course,
we have just started, we could say that.
It's just the start. Huh? it's just the start, and there's a lot to do internally. Of course, this is a challenge because all these solutions require from us a new level of collaboration. It requires competencies. We also have to train and educate our people, but also on the customer side, in the hospitals, the healthcare professionals, also they of course need to keep track on what's happening. And in the end, of course, we are all dependent on the legislation, that we have the right framework to be secure, to work in the right direction, to have a business model that is working in the end. If it comes for us, for example, to tenders, that we need to have the right environment to also be able to offer these solutions in tenders.